Tonight in Medical Rounds, Hartford HealthCare cancer specialists have delivered a new and exciting therapy to treat patients diagnosed with a relatively rare form of cancer. Joining us is Dr. Andrew Salner, radiation oncologist and medical director of the Hartford HealthCare Cancer Institute at Hartford Hospital. He helped oversee the team of individuals making the treatment possible. Dr. Salner, thank you so much for being with us tonight.
My pleasure, Erin.
So first off, this particular therapy is for the treatment of gastrointestinal neuroendocrine tumors. Can you explain what exactly these tumors are?
Sure. These are tumors that arise in special hormone-producing cells in the intestinal tract, either in the stomach, the small intestine, the appendix, large intestine, or the pancreas. They're also known as carcinoid tumors. They're relatively rare. They generally grow slowly, but they can spread to the liver or elsewhere in the body.
So previously there were limited treatment options available for this particular type of cancer. Can you tell us more about this targeted treatment?
Sure. Well, if the tumor is localized, it can be removed with surgery, but frequently these tumors are not localized, and we're now excited to be the first hospital in our region to introduce this new and exciting treatment, which actually is the combination of two things. It's a molecule that binds specifically just to the cancer cell, and it's a radioactive compound that is linked to that molecule so that when it binds, it delivers a potentially lethal blow to the cancer cell with the radiation.
And I understand there's a great deal of complexity in administering this type of treatment.
This treatment that's given intravenously, Erin, can injure the kidneys if it's not given carefully. So there's a whole host of medications that are given to help make sure that the kidneys are safe, and anti-nausea medications and other medications that are given to the patient over the course of about an 8-hour infusion, and the treatment is given once every 2 months for 4 treatments over 8 months.
And lastly, Dr. Salner, since Lutathera is part of a new class of drugs, is it likely that other drugs like this will emerge for other tumor types?
Yes, this class of drug is called protein receptor radionuclide therapies, or PRRTs, and I think this is the first of its class of a series of drugs, Erin, that will have targeted molecules to the cancer cells bound to a radioactive compound, in our case lutetium-177, that can give a high dose of radiation just to the tumor cells and not to the rest of the body. So it's a very exciting development. Many of these agents are now in clinical trial testing.
Good to hear, Dr. Salner. Thank you so much for your insight. We appreciate it. And if you would like more information, all you have to do is call the Hartford HealthCare Cancer Institute at 1-855-255-6181.